holidays, we're working on, team-based care, especially family practice. What can they do to make the healthcare environment or even just the work culture more welcoming to you, and how to support them?
Man, there's 5,000. I think that to start, you're gonna make jokes. Don't make jokes right away until we're on a good basis. Gosh, that's pretty tough. I think that's really difficult. Some of the things that, I was talking to a preceptor of mine looking at residency programs just yesterday, and looking at the types of people that we're going to be around with. I was looking at this really cool, awesome residency program, and there's absolutely nobody who looked like me. And I have a hard enough time going to the grocery store, or going to Shields and getting all around. Somebody needs to put something in my bag or something. Let alone stressed out to I'm bald now. I would appreciate it. Colleagues and coworkers were supportive. I don't want to hear the jokes all the time. Small microaggressions that really just make your day so much harder when you're already in a very competitive, hard, and difficult field. And as a colleague, if you don't look like me, and somebody who also doesn't look like me is saying something, they're probably going to listen to you before they're listening to me. And say, hey man, I kind of don't like that. Hey man, that's a little bit too much. We're not there yet, or something like that along those lines. I thought UND was awesome. It's the #1 school for producing Native American physicians. I'm very thankful that I've gone there, and I'm choosing him for sure. Some of the mindsets, even our classmates, make things just so much more difficult. You show up on med school, we're going to do it, we're going to learn how to help people, and it's like, you sit next to someone, and you're like, but is this logo really that offensive? And it's like, man, is that frustrating. Hi, my name is Waylon. I'm from it, but it's like, it's just like the most, and sometimes maybe that's the way people connect. But I would say, when you go start relationships like that, if you see somebody do something that you don't think is just right, maybe say, I wouldn't do that. Maybe that's a little bit tough. Maybe that was the one thing that pushed someone else to just be like, I'm done with that. People, you never know what people are going through, for sure.
I guess I kind of want to talk about the earlier stages before we even get to this point. UND offers a lot of great resources to Native students, high school, even lower than that, right? And there's MCAT prep courses and all these things, and that is so unique and niche in North Dakota that we need to spread this wider because it really starts earlier than where we are right now, and it took a lot to get us here, the rest of our classmates. And so I think the early intervention, early help, early funding, all of that is what really sets apart the differences and can help make huge changes in communities, because we do go through all of this, and there's so much, you lose so much of yourself, or it feels like you do in the time that you lose so much of yourself and your family. You sacrifice a lot to be here, and so just offering that support to everyone at every stage, I think would make a huge difference in the end. And InMed itself is a great program, and we need more InMeds across the country. But just, acting as mentors, if you take them on, if you're in healthcare yourself, offering your resources, offering high schoolers to come shadow you, see if that's really what they want to do, if they want to commit 12 years of their life to this practice before they're able to go back home and serve their people, I think is what would be really great for our audience members.
I think one of the biggest things that I think about is just like we have echoed, is supporting, giving support, mentorship, especially for people who don't have a lot of access to people in healthcare, especially like now navigating this residency thing. And that's been tough because you may not have somebody who's done that. So being able to have those resources and share that knowledge, I think would definitely help not only people like us, but those who are coming. Just offering that support.
And you kind of all touched on it, but how would you like to see, even like North Dakota institutions, or down to even your settler coworkers and peers, to support this work for health equity as we kind of
think about diversity, equity, and inclusion as the theme of the conference this year. So you can think really big, or you can think like really small, okay? Whatever you feel comfortable to discuss. For sure.
So the question was, what would you like to see from your sector coworkers and groups to support you and work towards health equity? So I think the very basic, starting with why health equity is very important. I think that was a big thing that we started off with medical school, understanding some of the things. There's a big push to understand, some of the historical things that have gone on in this country towards certain groups, and how there is strength and diversity, different thought process. If you want people to invest in taking care of a population, usually comes from the people in that population. We're going to go to help those people. But just to support, I don't know, I think the biggest thing people can do is act as a friend, and just encourage people all around if you need them, and too much about it. Just as a support and acting as a team member and sticking up for colleagues, making places welcoming to anybody.
I think the first point that you touched on is what are social determinants of health? What is historical trauma? What has history done to our people and the effects of it nowadays, and what is being perpetuated and what has been left in the past? It's important to understand the politics of where America is at right now and what's going on reservations and what is being taken, and I think it's just understanding like I said, the politics of just America as well as Indian country. It's important to know as a colleague, as a provider, as a friend, and doing education.
I also mentioned right up earlier about educating yourself before going to the profession. But I think that's one of the biggest things that I heard about is that we are always with you. Just take that time, to educate yourself, and then maybe after that go into the person and afterward get some research, either on the people that you're studying or maybe them as an individual, and ask some questions. Of course, no questions. I think it's going down with good intentions. I know I've gotten a couple of questions before that were kind of off the wall questions, and it was probably not okay to ask. And so just taking that time.
One thing I wanted to add, just snowballing off of Carlin, was that I think each of us have had to answer difficult questions or have difficult conversations. And I know, like Waylon brought up the Sioux logo, and how many times in mental have we had that conversation with people in our class? Like, I don't know, these are supposed to be caring, understanding individuals, and it becomes a very hostile conversation. And so, just if you're able to have just a heart-to-heart with one of your friends or someone who could explain why it is so offensive, and then bringing that conversation to white friends or things like that, so that we don't have to have that conversation 20 more times before we graduate from school. It would take a lot of stress off.
And kind of the final question I have, and then feel free to add anything you would like to go on a soapbox about, even if we haven't addressed it. But to welcome means to receive someone in a warm and friendly manner, and a lot of the topics you're bringing up really just sounds like